Flu season and COVID-19 are about to collide here. So now what? As if the coronavirus wasn't enough to worry about, the 2020-21 flu season is gearing up, giving those already nervous about every cough and sneeze more to fret over. Is my sore throat due to the flu? Is it COVID? What is going on? What's with the aches and pains? Well, now we're joined by board-certified family physician, Dr. Hillary Nash with HCA Midwest to help kind of sort it all out. Thank you for joining us.
Sure, good to be here.
I think this is going to be an issue here in the coming months, don't you? Trying to figure out which symptom goes with what?
Absolutely, absolutely. You're asking the same questions that we are sometimes as physicians too, to try to sort it out, because there's just so many of these symptoms that can, cross over the lines between these different diagnoses.
So what should we do? What should we be on the lookout for? And how do we know when it's time to seek your help?
I think there are a few symptoms that we know are somewhat specific to COVID. So we know that this loss of taste and loss of smell is something that should probably cue in that we need to look into it more. We know fever, flu is just around the corner. We haven't started seeing cases of influenza yet, but we will be within likely the next month or two. And we know that fever can be in both COVID and influenza, not usually with allergies. And many other viruses that can cause fever. However, if you are having high fevers, muscle aches, just kind of those flu-like symptoms, then that should be a big red flag that you need to probably contact your doctor to look more into it.
Yeah, maybe at this point, telemedicine is our best friend, huh?
Right. There's a few things that have come out of COVID that have actually been good, and telemedicine is one of them. As we've been able to kind of start to tap into that resource of being able to do these video conference calls with your doctor. I know at our office that we're able to do a telemed appointment, decide do they need to be seen, or can we just have them come through kind of a drive-by situation and swab them for COVID. Hopefully in the near future, we're going to have more of these rapid tests that can be done and get results within 15 or 20 minutes, much like the influenza test. And we'll be able to separate out some of these difficult cases to decide, if we need to manage them differently, and also avoid exposing everyone at the office to these germs, and avoid exposing the patient to all the other people at the office.
A scary few months ahead, no doubt about it. Dr. Nash, thank you for joining us this afternoon.
Yeah.
For more from HCA Midwest Health, go to kctv5.com/HCA Midwest.